Can you hear me, Madonna?
Yes, Ms. Gopika,
Yeah.
I can.
Yes.
So we have a couple of our audience joining.
Yes.
We would like to welcome all our attendees from all over the world. So far, we have some from Bahrain, we have some from India. Thank you everyone for joining us. We will be starting the session in a couple of minutes. I think we'll start the webinar now. Good morning, ladies and gentlemen. Good morning, Ms. Gopika Berry. Good morning, Dr. Sally. Good morning, Dr. Julie. We would like to welcome all of you to our breast cancer awareness. It's my pleasure to be moderating this session today. I will give you a short introduction about myself. My name is Madonna Clara D'Souza. I'm the training coordinator at the 9 Training Center. And it's my pleasure and my honor to be having to moderate this session today for all of you. And we hope to have a fruitful and a grateful session. And we hope to be getting very useful and informative tips from our speakers today. So without further ado, I would like to introduce our Managing Director of the 9 Training Center, Ms. Gopika Berry, to give us a short welcome speech. Ms. Gopika.
Thank you, Madonna. Salam alaikum and a very good morning to all of you. Your Excellencies, distinguished guests, ladies and gentlemen, it is our great honor to welcome you today to this lovely morning for the first Think Pink Awareness webinar. We are delighted to welcome Dr. Julie, founder and chairperson, Think Pink Bahrain Cancer Society, and Dr. Sally Adnan Al-Jabori, breast cancer surgeon, Bahrain Specialist Hospital. Bahrain Specialist Hospital has been our extremely valued client for over 5 years, and we thank them immensely for their ongoing support and cooperation. The color pink reflects different emotions, lives lost, lives changed in dramatic ways, And also, every speck of pink represents hope and victory. All of us today know someone who has breast cancer, who has become a victim, or who has survived through it. This is cause enough for all of us to support this worthy cause. I believe that with everyone's support in raising awareness about this disease, we can hopefully find a cure soon, inshallah. So, without much ado, I will hand over to Madonna, the Training Center's moderator, to take this event forward. And millions of thanks to everyone who has taken their valuable time to be with us for this Think Pink awareness session. Thank you very much.
Thank you, Ms. Gopika, for the beautiful words. Appreciate your presence with us today, this morning. Just before we start with Dr. Julie, I would like to inform our audience that you can have a question answer round with our panelists by raising your hand so we can pose your question. For written questions, we can have a box. You can view a box where you
Yes,
can ask your questions directly and which will be answered as well. And if you'd like to interact with the speaker directly to answer personal questions that you are not able to bring out in public, you can personally ask the panelists as well. So without much further ado, I would like to introduce our first speaker for today, Dr. Julie Sparker from the Think Pink Society Bahrain. She is the founder and the chairperson. So thank you so much for joining us today, Dr. Julie Sparker. I would like you to go ahead with the session, please. All the best.
Perfect. Thank you. I will just share my screen with you. Salam alaikum. Thank you very much for hosting me today. This is International Breast Cancer Awareness Month. It's something that my society has been doing in Bahrain since 2004. I'd like to give a little bit of a background to, let's just see. My background is that I'm a clinical nurse specialist. I just recently got my PhD in guideline development with the Supreme Council of Health and NHRA. The charity worked over 18 months to bring out the latest breast cancer guidelines, which were peer-reviewed and robust. The previous milestones included the mobile application, which I'd like to talk to you about today. But the background for Think Pink, this term was coined in 2004 by a group of us. It's not an affiliation with any other international bodies. There are Think Pink in Australia and in England, but when you have a look when they were established, it's a long time after the charity here in Bahrain was established. So I think that's pretty fantastic for a tiny island that we were the leaders in this sort of thing. I arrived in Bahrain in 2002. I was diagnosed with breast cancer at the age of 23, and that's why I started the charity itself. Obviously, my background in health and then further on into research, the charity always driven by evidence-based. And obviously, breast cancer is significant within the Middle East and to our national population here. Just some of the justifications and rationales behind things. The core of the charity's mission and vision is very much at the grassroots level and education. Education, we feel, is key, and awareness. This has grown from an awareness event to a very strong charity organization, which has raised over 3.8 million. We only campaign in the month of October. While it looks like we go quiet the rest of the year, we're looking at things like the decision aids, which have just been brought out. They're like a cheat sheet, things that you need to ask your clinician or things you didn't have time to ask your clinician during the time, in related to 4 of the clinical scenarios based on our guidelines. We have 3 very strong pillars: education, awareness, and research. We believe in supporting nationals in Bahrain and healthcare professionals because they will go away and get international qualifications which the charity pays for and better support their local community. When I started the charity, I didn't believe that I would be in Bahrain this longer time. And I wanted to structure it in a way that it would ensure that no one is paid for their services, that they always volunteer, and the structure was very strong. And we really look at empowering. Obviously, I'm Australian, but I'm very much Bahraini on the inside, and my children are Bahraini nationals. My husband is Bahraini. And it was very important as a figurehead not to have a local discourse. And so our campaigns, which you see, are very Arab-centered to support the local population. And the last one that you see on the bottom is based on research done in 2013 about part of the Qatar Foundation with the UK, who talk about empowering the men with information to better support women. The international ribbon is international, like it says. It was started in the 80s on a cosmetic counter in New York, Estee Lauder actually. But the I is the trademark for Think Pink within the region. It represents a male and female. It's very much unisex brand because we now know that men get breast cancer as well. Something that the charity organization had been talking about for several years. And His Excellency Sheikh Salman from King Hamad Hospital actually went to the newspapers 2 years ago to say that same thing. And so it's just as important that we empower the men in our lives to understand about the awareness. There's different ways that we raise funds. Obviously, it looks very glamorous, but there's a lot of hard work behind it. We have collaborations with organizations and businesses in Bahrain. We do the largest motorbike ride, which saw 170 motorbikes launch the awareness campaign last year. Obviously, we're adhering to His Excellency, the Crown Prince's guidelines in terms of COVID. We very much push to have an international qualifications for our healthcare providers. When I first arrived here, I was aware that there was no lymphedema therapists. Lymphedema can be an issue for some of our patients who have had mastectomies. So actually, we started with 6. We had them fly to Germany for a 1-month course and have a total of 12. The organization itself supports the system. So they would be the big teaching hospitals, Salmanir, King Hamad, and the BDF. And so the majority of healthcare professionals we've supported, from physios to nurses to doctors, are within these areas. We were also the first organization to have breast nurses. They had their masters at the Royal College of Surgeons, and all this was paid in full. So we have 5 in total, 2 at Salmanir, 2 at BDF, and 1 at King Hamad. These collaborations are really important and have been ensured that the money goes back into the Bahrain community. We're not allowed to accept donations from outside, as per Decree 50 from the King in 2011, and all the funds. So it's very much local businesses supporting us, and then we in turn are able to support the community. We have a board of 10, and we had our first virtual meeting this year, which is a unique spin on things. And we now have 3 gentlemen on board the board, which is for the first time since 2004, which is fantastic. Some of the milestones that we looked at this year, the funds that we raise will be going to the first year payment of a PhD student. You can see this in the text here. It's a journal article. The charity did a pilot study, and we sponsored Fatima to further her research. And she looked into something that was very unique within this region. It was in genetics, so it's all lab work. Only 0.3% of the GDP of Bahrain is spent on research, and so locally centered research is very important. We can't take the statistics and the references from an international perspective when it doesn't relate to the local cohort. This project with her PhD will change the shape of screening in the Middle East because she detected a genetic mutation that is specific to the national population. So we're encouraging her to do her PhD and grow on that research and have a bigger cohort. So we're super excited about that. One of the other big milestones, you see the picture of the machine. We fully paid for the 500,000 dinar, 1.5 Tesla MRI machine, a diagnostic tool, not a screening tool, a diagnostic tool for women that are at higher risk. And it's operational within Salmanir. It was a very big campaign, and basically the community bought this. So we were super thrilled about things like that. One of the other big milestones, 4 years ago, we developed a mobile application, which is the first in the region. It's called iCheck, obviously our brand, iCheck. It's in Arabic and in English, and this was based on a gap. We always look at gaps where things are needed. We were printing out the leaflets, breast self-examination leaflets, and we realized that having a mobile application sort of closed the door for a lot of the privacy issues and the things that were being reverted back to us in our focus groups. And so the app was developed. We had the support of Bahrain Polytechnic. They helped us record the tutorial. And it very much fits into our campaign for Not Just October, which we'll be launching in January 2021. Breast cancer is not just diagnosed in the month of October, but you would be hard pushed to think otherwise, because after the 31st, the ribbons are packed away and we move on to Diabetes International Awareness Month and prostate cancer, and the blue ribbons come out. So the mobile application is a great reminder about being breast aware. And that for us is the key. So you need to know the changes in your body to be able to see clinicians like Dr. Sally at the various hospitals, to know that what your normal is, and to be able to go to them and say, this is the change that I've experienced. Within the mobile application, in the frequently asked questions, our new decision aids, which I allude to at the beginning of my talk. These are cheat sheets. They are done with EBSCO, a commissioned collaboration, over a year worth of work. They're a one-page document with all the references on the back in relation to reconstruction, screening per age group, and you can find that in the bio of the charity's organization and on our new website, which is going to be a portal of information. These are our big milestones. We are very much driven by the support of the community and their needs. We do not supply or support individuals at a financial level, but we support the system as a whole. And we believe by educating within the schools, as we do within the societies, that we're able to make a change. And we've seen that. We've seen that since 2014. We have a conversation now. We're having a conversation. We didn't have a skyline as big as we have in Bahrain in 2004 when we started, and you'll see that the skyline during October is highlighted in pink. A lot of the organizations either support Think Pink, the only breast cancer charity on the island, or they're supporting Bahrain Cancer Society, or they're doing it as part of their corporate responsibility to highlight their buildings. So I feel like we've been the antagonist in a way to start a conversation, which is pretty special. This is more about the application. Not that I'd encourage people to be on their phones while someone's talking, but I would be happy if you're able to download the application in Arabic and English, which is free of charge. It tells you the basic things, signs and symptoms, and the tutorial that you can go through, and will set a reminder once you plug in your different data. It will set a reminder every month, because being breast aware is being aware of your normal. And it's not something that you need to just look at in October. It's all year round. You should be doing your self-evaluation, your self-assessment of being breast aware once a month. So these are the things that the icons that you can look for in the different respective Play stores. Like I said, the mobile app was developed as a master's project for one of the board, and it got rid of self-examination cards and we went digital. This is a snapshot of what we worked with Supreme Council of Health. It was an 18-month project and was the basis for my PhD. It's the pathway. A lot of our patients, a lot of the community want to know the pathway that we need to go. This is all evidence-based. It was internationally peer-reviewed by some of the top epidemiologists in the world. It's had a lot of traction, and you can also find this in a publication that was done in 2019 as an attachment. That's about all I have for you in terms of rounding up and a background. And I appreciate the platform to create this awareness. And I'm very thankful to Nine Training and Madonna. Thank you very much.
Thank you, Dr. Julie. That was really informative of you. We have a question from one of our attendees, from Dr. Durrani.
Okay.
Is there any latest data for how many diagnosed cases of breast cancer in Bahrain? This is the question that he has asked us. So maybe if you could probably shed light on that.
Yeah, we get the data from IAC, which is the governing body over the WHO, and it's the Ministry of Health who sends that data accordingly. We have a lot of older data which has been published, but you can go onto the IAC website and you can get what has been sent across to them. Now with the Centre of Excellence being King Hamad and the Tumour Board being based in King Hamad Hospital, I'm sure that would have been updated. I haven't been on the site myself, but we do know that nationals are being diagnosed 10 to 15 years younger than our Western counterparts, presenting in stages 2 and 3, and that's why the mobile application is critical about being self-aware.
All right, thank you, Dr. Julie. I hope, Dr. Durrani, Dr. Julie has answered your question. And I would like to ask you as well, Dr. Julie, what inspired you to take on this awareness program? What inspired you to, be a part of this wonderful campaign, the breast cancer?
In terms of Nine Training, or in general?
In general, what has inspired you to support this awareness, the breast cancer awareness?
Well, as I said, I was diagnosed at the age of 23, and when I came to Bahrain, there was no awareness campaign that I was aware of. Also, I'm slightly stubborn. That's the Dutch and the Australian part of me. And whilst I did work under the umbrella of Bahrain Cancer Society for the first 3 years, I wanted to establish the first standalone breast cancer organization. The charity supported Bahrain Cancer Society with 120,000 dinar for the free mammography drive, which was part of their 2005 campaign, which has now been taken over by the Ministry of Health. I'm inspired by going into some of the government schools and having one person come up to me and say, "Thank you so much, a child, you supported my mum." And so all the drama related to an NGO and businesses and things melts away because I know that we're making a difference. So that drives me. And my daughter, she's the future of Bahrain. She's only 3, but she's the future. So I want to make a change for her.
That's really wonderful, Dr. Julie. That's really, really beautiful. Once again, we thank you so much for being a part of this session, and
thank you.
Really, really thank you for joining us today and giving us a very fruitful and a very informative talk about breast cancer. And maybe you could give us an inspiration talk on how to probably, what do you say, uh, inspire people to, join the iCare app? Like, how would you allow them to, where
Drive
can you
them
find it?
to-
On Google, on for Samsung
Yeah,
users,
on
for
both,
iPhone?
it's for Androids and iPhones. It's free of charge. Download it, have a look. It's an educational tool. It's actually being used in a research project in a Malaysian university, which is fantastic as a tool, which is brilliant. Obviously, it's based here and it was developed here, but the Play stores don't have discrimination. It's international, and we've actually had a 340% increase since the 6th of October in downloads. So, and the bounce rate, meaning that they haven't deleted it. So, inshallah, I've said something inspirational along the way, but it's more just being proactive about your health. You know, we can bury our head in the sand, and I'd much rather spend, 5 to 10 dinar and go and see the likes of professionals like Dr. Sally in hospitals and have her tell me, Julie, it's an ingrown hair, or actually it's a fibroid adenoma. I need to be proactive about my health. I don't need to be scared into a situation because we're bombarded with things in October. I'd much rather teach my children to be proactive. And I think the mobile application is a great way for that.
Great. So we would all like to encourage everyone to download this mobile app and be health aware as well. Thank you so much, Dr. Julie.
You're welcome.
Thank you so much for giving us this talk. Now we would go ahead with our second speaker for the day, Dr. Sally from Bahrain Specialist Hospital. She is a breast cancer surgeon. So, Dr. Sally, we would like to welcome you on board this morning for this talk, for the breast cancer awareness talk. So now you can just go ahead with your session. I will just request you to share your screen for your presentation. Dr. Sally, yes.
Assalamu alaikum and good morning, everyone. I would like to thank you for giving me the opportunity to partake in this event. It's a real pleasure. Now, Breast Cancer Awareness Month is in October, as everybody knows, and it's a great time to have an opportunity to discuss breast cancer awareness. So, breast cancer, how common is it? It is the most common cancer in women and second leading cause of cancer-related death in women. Death rates have been steadily going down since 1989. Now, what is breast cancer? So the female breast is made up of lobules, which are the milk-producing glands, and ducts, which are tubes that carry the milk from the lobules to the nipple. Now, the other structure is the stroma, or fatty tissue, and connective tissue that surrounds it. I'll give you this is, I think it's more clear. You can see the lobes that form that form the milk, and then the ducts that convey the milk to the nipple, and the surrounding structures, which is the fatty tissue that contains lymph, lymphatics, and blood vessels and fatty tissue. Now, what exactly is breast cancer? Cancer is growth of abnormal cells. The meaning of cancer is growth of abnormal cells. The cells can invade and damage normal tissue. And breast cancer can start in any part of the breast. There are two main types, which are the ductal cancer, which means the cancer that starts in the ducts that carry the milk to the nipple, And the other type is the lobular cancer, which means that the cancer starts in the milk-producing lobules, which empty into the ducts that carry the milk to the nipple. Now, what are the causes of breast cancer? We do not have a specific cause, or we do not know the causes of most breast cancers, but most likely the cause is related to changes, or what we call as mutation, and genetic material, the DNA in our cells. Now, cellular DNA damage leads to out of control cell growth, and DNA changes are often related to our lifestyle, but some can be due to age and other factors. Risk factors are anything that can increase or decrease a person's chance of getting a disease, such as cancer. There are many known risk factors for breast cancer. Some of these cannot be changed, but some can, which is important. Now, gender, being a woman, is a main risk factor for developing breast cancer. Having saying that, 1% of breast cancer can be found in men. Genetic factors are important. They form about 5 to 10% of breast cancer cases, and they're thought to be hereditary, caused by gene changes or mutations inherited from parents. Now, inherited mutations in the BRCA1 or BRCA2, these are two different types of genes. They are the most common types of hereditary breast cancer. So women with the BRCA mutation have an increase of developing cancer during their lifetime. And when they develop it, they are often younger than other women with the breast cancer who are not born with one of those gene mutations. Other types of genes are less common causes of inherited breast cancer. Aging is also a risk factor. The more increase in age, the more likelihood of getting the cancer. Family history of breast cancer is very important. Women who have a close blood relative with disease have higher risk of breast cancer. For example, maternal aunt, mother, maternal grandmother. This is very important. Personal history of breast cancer. A woman with cancer in one breast has an increased risk of developing a new cancer in the other breast or in the other part of the same breast if the original treatment was just a localized treatment. Postmenopausal hormone therapy that is being used to reduce the signs and symptoms of postmenopause. This may increase the risk of developing breast cancer. Recent use of hormonal contraceptive may also give a slight higher risk than women who never use them. But this usually goes after stopping the treatment. Not having children or having them later in life after the age of 30 put women at a slightly higher risk. And not breastfeeding. Studies suggest that breastfeeding may lower the breast cancer risk. So pregnancy and breastfeeding are protective against breast cancer. Now, more menstrual cycles, a slightly higher risk if women started menstruation early or went through menopause late. Physical activity, more active, lowers risk. Overweight, obesity raises risk of having breast cancer, especially with women after menopause. And alcohol use clearly linked to increased risk. Risk goes with the amount of alcohol you drink. Now, the important thing is preventing cancer, breast cancer. There is no sure way to prevent cancer, breast cancer completely. But there are things a woman can do that might reduce the risk and help increase the odds that if they do get breast cancer, it's found at an early, more treatable stage. Now, how can we lower the risk? This is get to and stay at a healthy weight, be physically active, limit alcohol use, breastfeeding, not using hormonal therapy to deal with symptoms of menopause. If a woman is known to be an increased risk due to personal or family history or known gene mutation, there are some things she can consider to decrease her chance of breast cancer. For example, cancer preventive surgery for women with for women with very high breast cancer risk. And the most important thing of preventing breast cancer is breast screening. Now, screening is testing to find cancer or other diseases early in people who have no symptoms. Screening can help find cancers when they are small and have not spread, when they have a better chance of being cured. Breast cancer screening is done with clinical examination and mammogram. In some cases, we may use MRI. Now, clinical breast exam, this is very important. It should be done by a healthcare professional. And breast examination is just as important. It should be done once a month. Usually we prefer at the end of the menstrual cycle, 6-day menses, where we teach the woman to stand opposite to a mirror before taking a bath, and to examine both, look at the breasts first, and then to examine both breasts. Now, the other component of screening is as I mentioned, the mammogram. It is an X-ray of the breast. For a mammogram, the breast is pressed between two plates to flatten and spread the tissue. It produces a picture of the breast tissue itself. Now, for certain women who are unable to do a mammogram or have a high risk of breast cancer, an MRI may sometimes be recommended along with the yearly mammogram. MRI scans use magnetic and radioactive waves instead of X-rays, and they give detailed cross-sectional pictures of the breast. Now, screening recommendation. When do we start screening? This is a very common question that a lot of people ask. So we start with women in their 20s and 30s. They should have a clinical breast exam as part of regular health checkup by a health professional every 3 years. And after the age of 40, it will become annual screening. They should have annual examination after the age of 40 with the mammogram done every year. And as I said, self-breast exam is very important. You should start early, because you can detect early changes in breast tissue by regularly examining your breast. You will know your tissue, your type of breast, your how it feels. So anything new, anything that's not you haven't felt before, you'll detect it early. So what should I look for? These are important questions. What are the signs? What are the symptoms? What do I look for? When I'm examining the breast or having my self-breast examination? First and most important is the appearance of a lump, okay, or a swelling in the breast. Usually it's hard, regular. This is a very common sign. Second, nipple discharge, which usually is bloody. This may give the diagnosis of cancer. Presence of swelling in the breast. You see the breast, the shape or the size is different from the other breast. Okay. Redness of the breast or nipple, and skin changes of the breast. These are important signs and symptoms. When you notice them, you should seek clinical advice early. Now, these are pictures of different types of clinical presentation of breast cancer. If you can see here, the upper photo on the right shows nipple discharge, which is bloody in nature. The second photo up, you can see large swollen breast with, if you can notice, ulceration of skin on the top. This is an advanced form of cancer. You can see also that the nipple is retracted, it's inside. Okay, this is another important sign of cancer. And then the lower photo, you can see the skin changes. This is associated with breast cancer. This is what we call as the pure orange, or it resembles the peel of an orange. You can see the skin changes. Also, it's a picture of an advanced cancer. Now, breast cancer standard treatment, there are different treatments. It depends on the patient, the age, the comorbidities, the type of cancer, the staging of the cancer, if it's spread or not. It depends on a lot of factors. We have the local and systemic type of treatment. And as I said, it depends on the each patient has a different, it's not unified. Each patient has a different recommended type of treatment. Now, any questions?
Thank you, Dr. Sally, for the very informative presentation. I believe we have one question from Hussein Al-Shahlan. He asked us, for which ages does the breast, like, which age would you recommend the breast cancer checkup?
You mean the screening? The age of screening? Screening starts at 40, usually. Those people who have very strong family history, we may start a little bit before, but it's recommended at the age of 40.
All right. And how often should we screen? On a daily basis, on a monthly basis, a quarterly basis, annually, or how often should we?
When I'm saying screening, breast screening, what I mean by this, it is clinical by a health professional examination, plus the mammogram or radiology or ultrasound, whatever we use. It depends on the patient and themselves. Anyway, this is usually done once a year after the age of 40. Okay. Sometimes we recommend yearly. Depends on each patient, because they have any family history, any abnormalities in the the original mammogram or the ultrasound. It depends, but it's usually we recommend annual examination. Yeah, that means once per year. It's very simple. It doesn't take a long time, and a lot of women ask me, oh, doctor, you want me to do every year an X-ray? This is bad. We can't get cancer out of it. This is radiation. It's the percentage of radiation is very low for the mammogram, and it does not harm you. And it's very simple. It doesn't take a long time, and it's once a year. So the benefit of getting a screening is great. So I really recommend it.
Are there any certain foods or vitamins or supplements that you would recommend us to take and not to take?
It's not a matter of taking. It's a matter of a health style. If you're eating healthy, your physical, this is very important. We do recommend women after age of 50 to take regular multivitamins, but as I said, it depends on your diet itself. What are you consuming? What healthy foods are you taking? And the degree of physical activity. This is very important.
All right, Dr. Sally, are there any possible side effects of the treatments that you just mentioned, the mammogram, the screening? that we're supposed to be aware of? Is there any
No,
possible
as
side
I
effects?
mentioned, as I mentioned, the mammogram, the risk of the radiation, it's the radiations that it's used, it's very low. So it's just nothing. But there are some cases, as I mentioned, we use an MRI instead of a mammogram. Then there are some cases that are not clear by mammogram, or if you cannot use it, we have the other option.
Okay, all right. So I think we are almost now done with our session. Once again, thank you, Dr. Sally, for this wonderful presentation. It was very, very informative from your side. Um, we'd like to thank all our attendees as well for participating and joining us today in this session. Once again, we thank Dr. Julie for joining us and being a part of this. And we'd like to thank our Managing Director, Ms. Gopika Berry, as well, for taking the lead and making sure that we have this awareness session for all of us. Thank you, Ms. Gopika. Would you like to say a few words?
Yes, thank you very much, Dr. Julie and Dr. Sally, for this wonderful information. It's extremely valuable, and I'm sure the attendees have, all their questions have been answered, and they've got valuable information too. Madonna, if you could share which are the other countries that are participating today with us?
We have a couple of participants from India and from Bahrain as well. I'm not able to see their
And also, I believe UAE.
nationality.
Yeah, okay.
Yes, from UAE as well. Let me just, yes, from UAE as well. Yes.
Thank you very
Great.
much. And
So thank you all of us. Yes.
I would also like to thank Bahrain Specialist Hospital for giving us their expert, Dr. Sally, to give us this wonderful information. Thank you once again, everyone.
Thank you. Thank you, Dr. Sally. Thank you, Dr. Julie. Thank you, Ms. Gopika, for being a part of this, and hope to see you for the next. Thank you so much. Have a lovely day, all of you. Thank you, everyone, for joining us today. Thank you. Stay safe, everyone. Thank you.